So to start us off, could you tell me a little bit about your clinical expertise and training? So like what kind of work do you do?
Yeah, I'm a social worker. I currently have a private practice in the Boston area of Massachusetts. I see mostly couples and families, and I do see individuals as well. And I prioritize Asian Americans in my
So
practice.
can you tell us a little bit of how your work may differ from other types of therapists? So I know you talked a little bit how you focus on like couples and individuals. Do you want to
Sure.
maybe expand a little bit on that?
Yeah. So I think it probably would help if I explain the primary modality that I use, which is emotionally focused therapy. And that is basically it's attachment theory in practice. So in the work that I do with everybody, it's really looking at and making sense of the ways that people interact with their world and relationally through an attachment lens. And I know that there's sometimes people say emotion focused and they use it interchangeably with emotionally focused, and the difference is emotion focused looks at emotion as the change agent, is the thing that creates change in people. And emotionally focused therapy takes that one step farther and says that yes, that is the change agent, but it also happens within relationship. And so the way that we really make change is through relationship with other people and being engaged in responsive, available connection with other people. Uh, does that help?
Yes, thank you. Yeah, so kind of moving from that, I know you've kind of touched that you do work with like Asian or Asian American populations. So, like, how does that kind of look like? Like, do you kind of tailor your practice a little bit to talk about maybe Asian specific struggles or like diversity issues? Can you talk a little bit about that?
Yeah. So I'm biracial. I grew up with my mother who was Chinese. She passed away. So she was really my whole framework for understanding the world. And I know that I think you're going to ask me this question later, but I think maybe this is a roundabout way. I'll bring it back here. I realized really young that my mom had had quite a bit of trauma, as a lot of, sadly, a lot of the diaspora has experienced. And somehow I could see that she was unable to be responsive to me because of what had happened to her. And um, I really find like, and I find that in my, I don't know if you experience this, but I feel like a lot of growing up, the Asian American community that I've been around has been very disconnected. It's been very private. Being mixed race, I think I also had an additional barrier sometimes because I
Mhm.
felt like not Asian enough, not white enough. And so when I really prioritize making space for Asian Americans, because what I found is that most of us really want to talk about what's happening and make sense of it, but there hasn't been a space for us to do that. And I
Mhm.
know that my mom was really limited in her ability to talk with me about it, and had very bad experiences trying to get mental health help when she was, back in the 80s. And I really want that to be different. So I think being able to enter into a relationship with some shared understanding, right, of that there there are things that are similar, but there are also things that are very different, based because we're not all the same. And even, a biracial Chinese American person and I are going to have very different experiences. I think the making space for there's so many things that have happened without judgment, and with like, yes, that makes sense, that this is happening in your life, that this is the feeling that you had, that you struggle with really wanting to um, make your parents proud, and also feeling like you can't do something for yourself,
Mhm.
right? Like, and I think being able to just sit with that without pathologizing it is one of the most important things for the people that I work with. Because I think we end up spending so much effort when I've been to therapy and spending time trying to explain and bring somebody up to speed of like, no, this is within the normal,
Right, right.
this is what we all experience. So yeah, so I think making space for that. And I think, you know, one of the things I love about EFT is it is non-pathologizing, which means that we're not like there's nothing inherently wrong. We're not looking for a problem with a person. Um, I think we over pathologize relational distress and call it, you know, depression, anxiety. And I'm not saying that those things aren't real, but I think we end up looking at it as though it's an individual problem. And we miss out on how being disconnected, feeling invisible, feeling marginalized makes sense that one would feel depressed. And it's not on the individual all by themselves to figure out how to overcome that. I know I'm talking all over the place now.
No, no, it's okay. It's really good.
Are you with me?
Yeah, yeah, yeah.
Okay.
That's really good. And it did kind of move into our next section. I was going to ask you kind of about like maybe what inspired you to pursue this work. And I think you really touched on that, like your past and your family. Um, but I guess kind of moving through that, I guess today, have you encountered any challenges in your work when you're trying to kind of move through that journey?
There aren't a lot of Asian American mental health providers, especially on the East, well, in the Boston area. And trying to connect with people and stay engaged with the community, I think is really hard. I feel like I'm constantly trying to send out, connecting emails and develop relationships. And we are I think it's a product of the racialization of the Asian diaspora, right? Like that we're isolated. It's very hard. There's a lot of extra, I wouldn't even say concrete barriers, but sort of social implied barriers since 2016 and then again in 2020 with COVID. I think a lot of people's anti-Asian bias has come up in ways that that was never explicit. Most of it felt very passive up until then. And I think it was really shocking in some ways emotionally. I don't think shocking intellectually, but to feel that with people that I have built relationships with over the years, um, to realize the tremendous gap between, that there is often between a really white dominated um, profession and Asian American therapists. So that's been hard. I think it's been hard to not be like I end up feeling like in some ways I'm the token Asian when somebody has an Asian client, like send them to SuMing,
Hmm,
and I welcome everybody.
right.
um, but I think that it it skirts their work, right? Of like dealing with their own biases, and not that clients should have to work through that with their therapists, but I don't think the solution is just, only Asian therapists seeing Asian clients.
So part of the work we do at Asian Mental Health Collective is to break down barriers to accessing mental health resources and services. And so one thing that continues to be a barrier is the stigma around needing mental health help, something that you touched on earlier. So maybe could you share or elaborate briefly on why you think like your specific work and therapy overall is important, especially for the Asian American diaspora?
Um, I could get going on this because I think part of the problem is that it's so medicalized in the US that people really, when they go for mental health, it's like, oh, there's something wrong with me. And I understand, I'm fully, understand that um, our ancestors often, there aren't words for some of the things that we struggle with, in the discourse of mental health in the United
Hmm.
States. So there is that gap as well. But I think that part of what gets in the way is like, though, there's something wrong with me. There's something weak about going and getting help.
Hmm.
And one of the things that I really work towards in my practice and through the kind of work that I do is really trying to destigmatize that. Like, of course you're anxious. Of course you're depressed. It is not because of some deficit within you. It's because of all of the things that you're having to metabolize and not having anywhere to go to
Hmm.
help you with that. And we're supposed to be able to go to people for help with that. And that looks different. That might look different in, a white American family than it might look like in, a Chinese family in China. But I don't know if you're familiar with John Bowlby, but like this attachment piece,
Right.
those cues are still there. They might look a little different, but there's still this, like, when I need you, do I have somebody who's responsive and can turn to me and
Hmm.
make me and help me feel safe and help take care of me? And if something goes wrong, will we be able to repair and reach each other? And I think that I would love to just shift the whole paradigm and from, if you have to go see a therapist, that means that you have I mean, part of this is me going off, the mental health industrial complex, right? Like, people have to use insurance, and so then it has to have a diagnosis, and then that's a pathologized diagnosis mostly,
Right.
so you have to sort of cognitively override that if you're struggling with that. And I wish that we could just shift the whole paradigm of, like, most of these things, it's not that there aren't necessarily biological genetic components to it, but they also are really socially situated in our
Hmm.
contexts. And I
Right.
think so much a reflection of the interpersonal needs that we have. And I know that some other countries, I think, oh, I don't remember. So there's another country, I think it's maybe Switzerland. Oh, I don't think it's Switzerland, but they have a real systemic and family-centered approach to dealing with serious mental illness. Like, they don't institutionalize their family members who have schizophrenia, for example. They have really wraparound services, and those actually help manage symptoms. And that's not the only way, but I think, we really miss the mark in this country, and it makes it hard for a lot of people to take that step if they're already feeling resistant or scared.
Yeah, that's really good insight. So I guess because, it might be hard for people to access things or kind of get started, do you have any maybe suggestions for specific cultural or community resources that you might recommend to your clients to get them started, or, support groups or anything like that?
Um, I think the Asian American memoirs that have come out in the last 3 years, 5 years. I mean, I read them like I'm drinking water. They're amazing. They're so
Hmm.
good. And I think that they really help with this feeling of aloneness that so many of us feel. And they normalize, they give language, right? It's not everybody, everybody's going to have a different experience, but I think most of us can relate to some of the stories and the way that some of the authors describe what's happened to them. And it might offer a different way of thinking about something. It might make you feel less alone. Um, and I think that in those ways, right, like when we want to do something scary, we feel more brave when we have a safe base to come back to. And even if you can't find somebody, if you don't have anybody in your life that's supporting you, um, I have found, right, like memoirs and I think the Asian Mental Health Collective has got a lot of great videos on Instagram and a lot of great
Hmm.
resources. Um, Going to those places as sort of a place to return to when you feel scared to move forward, because I think that the narratives that come out from there really help us with aloneness, and, like, okay, there you're not the only one feeling this way. Um, and it can give you the courage to go and try again, because not every time you find, like, sometimes people look great on paper and you walk into their office or get on the Zoom call and you're like, this isn't working,
Hmm.
and that can also be that's really common, and it's okay, it takes time, but it does take a lot of energy out of people. And I think that it makes sense why people are reluctant to, it's like, oh, if I start this, I might, what if I don't like this therapist and I have to start over again?
Hmm.
And then what if I don't like that one? What I don't want to do this. It's too hard. And it makes so much sense. And so I think, wherever you can find places where you feel less alone, even if that's in books or podcasts or short videos or different readings, those are really good places to help, you know, resource yourself and be patient with yourself.
Have you personally had any experiences with therapy yourself as a mental health professional? And then what have been some of the takeaways from your experiences that have stuck with you as you've grown?
Yes, I've been in therapy. I'm currently in therapy. I'm usually in therapy. I've had a couple breaks in my life, but I have found it to be really, it's like, I sometimes use this with my clients, but for me, especially, I feel like it's kind of a laboratory or a playground to practice what's happening
Hmm.
with my therapist. It's a relational experience. So I get to try things that I'd be terrified to try in my real life. Like,
Hmm.
when you said that, this is how I felt, or what's that look in your face? What does that mean? And that takes a lot of courage over time to build, but then you get to actually see what's on the other side. And my hope for everybody, I think everybody deserves a therapist that can tolerate that can sit with that like really wants to engage in that way.
Hmm.
Um, because it's really, I think for me, therapy is relational. It's not just come go see the doctor and do these 5 things, or here's a task list, and then you're going to start feeling better. You know, if it were that simple, I don't think people would go to therapy, right? It would be like, oh, I can just tell myself to, set my alarm for 5 a.m. every morning, and I'll go to the gym, and then I'll feel good and I won't feel depressed anymore. It's so much more about what happens in between the quote unquote like behaviors or interventions. It's the meaning that we make of it. And so I as a client, it has helped me so much to be a better therapist, to know what it feels like to be kind of like, I don't know what's happening here. I don't know what they're thinking. And sometimes I'm like, oh, if I were the therapist, this is what I would be thinking. And that's really hard to talk
Yeah.
about. But I think being able to take risks and work through some of the difficult things that come up, because undoubtedly if you are in therapy for long enough, which could vary for somebody, there's going to be a rupture. There's going to be something where your therapist let you feel let down by your therapist. And I had felt that way about something around actually my being biracial, and it was really difficult to work through that, but it was so important. It was so
Hmm.
important to take the risk, and um, for me as a client to be able to say, this didn't feel good, and I don't know like what's happening for you, without having to go and take care of my therapist. Um, and that was really ended up being a very reparative experience for me, even outside of therapy. And that's something that I can carry with me forever.
Right.
Yeah.
Yeah, thank you. That was really insightful. I guess just to kind of wrap up, so for our community, what is some advice that you have for someone wanting to explore their mental health, whether it might be learning about topics or starting to go to therapy or even pursuing a career in the mental health field?
Yes, do it. um, I think we need so many more people who can hold the complexity of being Asian American in this work, because it is complicated and understudied, and people are not, even the research that's out there. It's really, you mentioned you're going to be doing some studying of second generation um, children and immigrant parents, and you're really interested in that. I'm actually in a doctoral program right now, and I'm looking at Asian American families and family estrangement through a sociopolitical and intergenerational lens. Um, and so I've done a lot of research now about like all the research that's out there on Asian Americans and families. And it's really it's really interesting to see the subtleties about our own internalized oppression that come through. And what I mean by that is that so much of the research is focused on the problems of Asian American families and not about the strengths. And, when you read paper after paper that shows, oh, look at these deficits, right? It's like, how can you walk away after reading all of those thinking like, oh gosh, it's great to be in an Asian American family,
Mm-hmm.
you know?
Mm-hmm.
And so I want to encourage everybody to learn more so that we can complicate the dialogue. We can make it more rich and expansive and capture all kinds of different stories, not just the ones that are looking at what's wrong with us.
Mm-hmm.
And, I think the other piece that just really gets missed when we're looking at the Asian American diaspora is, yes, they talk a lot about how immigration affects us, but they don't talk about why it's so hard to be not white, being an immigrant, coming to the States, having to deal with a very particular kind of racialization and
Mm-hmm.
how that affects us. Like it was very hard to find much of anything about that. And I'm not a professional researcher. I'm still, there may be things that I've missed, but those are some of the things that come across for me. And so I really encourage everybody who's interested to go in and make some noise and complicate the dialogue.
Yeah, great. So I guess that kind of touched on people looking to enter the professional mental health field. But kind of on the other side, did you have any tips for anyone that's, I guess, looking for being on the receiving end, I guess like a client or trying to start getting help for their mental health and stuff like that?
Yeah. I think it just, be brave. And if it doesn't work out the first time, it's okay. It's not anything to do with that person. It is hard and our system is not set up to make it easy. And there are so many organizations out there right now that are really trying to do that. And so I would say like keep going, keep trying. Um, and if you're brave, ask your friends and see if they have a therapist that they like. I've gotten some great word of mouth referrals from previous clients because it can be really scary, but it can be totally life changing and really wonderful. So I think it's worth the risk.
Great. Yeah, thank you. So that kind of concludes our time today. It has been wonderful talking to you. We're so grateful to have you, SuMing, for join us for this therapy chat. I do want to be mindful of your time, and these were all of our questions that we had for you, and you very succinctly and nicely answered all of them. So thank you so much. It was great to hear from you.